So my name is Michelle Burrows. I am the Director for Community Engagement and Outreach for the University of California, Riverside School of Medicine. And I work for the Center for Healthy Communities. And I started all of this because of a burning desire. So first of all, we are not included in conversations that we need to be included in. We are not a part of research, and I know research is kind of a little bit of a not great word in our community as well as other communities of color, but we are not included and our voices aren't heard. And when I was originally approached about this, it was to do an NIH clinical trials. And it was when COVID first came out. And I said, yeah, no, I'm not going out there telling my people to be a part of a clinical trial because I'm not going to go out there. I'm not going to be the poster child for a clinical trial because, right, we didn't know what was going on with COVID. So everybody was very fearful and very afraid. But now, fast forward, right, things have moved so quickly. First, we were talking about testing and the importance of being tested and then vaccinated. So now we're talking about long haul COVID. We're still talking about COVID, but now my community has reached out and said, you know, we're experiencing some signs and some symptoms of COVID, long haul COVID, and we really want to have conversations in places that we can safely talk about our concerns, our fears, things that, you know, we can't really necessarily feel comfortable talking to with our providers. So we decided that we were going to do a series of town halls. So I appreciate all of you being here. I appreciate you wanting to come out and learn, and I'm hoping that you will share this information with others. It's very important, of course, dear to my heart, because I, as a Black woman, I've lost many in this pandemic. And it's been very hard because I am a public health practitioner. And when I realized that friends and families, you know, weren't listening to the things that I was sharing with them, and I was running out telling everybody. As soon as I got the word and information that I felt was true and I could trust, I was sharing it with my friends and family. And to hear and witness some of them, you know, decide that they did not want to take the information and make good decisions about their health. And some of them lost, you know, their lives. Some of them are suffering now on ventilators, still dealing with, you know, fighting for their lives as a result of COVID. So I'm tired, I'll be honest with you, I'm tired of hearing disproportionately affected the Black community about everything. It's not just COVID, it's everything. And it's been going on for years. And we kind of turned a blind eye and said, oh, well, yeah, I may have this preventable illness, but you know, it's not affecting me right now. And then COVID turned up, and if you had a little nick, you know, you were like, oh, now it's a big old whelping, gaping, you know, hole in my leg. So I really feel like these town halls are very, very important, and we need to make sure that we are coming out, we are educating ourselves. We perish for lack of knowledge. So we need to make sure that we continue to educate ourselves, seek information. If that's one thing that we learned from COVID, is that we need to be educated. We need to do the research ourselves and make sure that we're informed so we can make informed decisions about our health. So I appreciate all of you all for coming out, spending your time with us this evening, and I know that you will be blessed by the information that you received, and it will help you be able to make informed decisions moving forward. So I want to get started. I kind of went on my tangent, so thank you for being patient with that. But I want to get started, so I want to share some stats with you so you know that I'm not just kind of making this up. Hi. Okay. Well, we'll first introduce some of our speakers. So Brittany Whitmore. Brittany is wonderful. She is an educator. She has done so many things, as you can see. I will let you read her bio. I will not read it for you, but she has been one of those soldiers out in the community, advocating and educating community about COVID and so many other things. But she is a public health professional as well, and I just really appreciate Brittany coming out and sharing the information that she's going to share this evening with you about how you can continue to stay safe as it relates to COVID, and also things that you can do to ensure that you can hopefully not, end up with long haul COVID. And then our featured speaker this evening is going to be Dr. Ajeko, and she is Associate Professor of Psychiatry and Neuroscience at the School of Medicine. We are so fortunate to have her, and it's very important for me when I do these town halls that we have health professionals that look like us speaking to us, because then it removes a barrier that's already there. Culturally, she understands our plight, our walk in life, and so I want you all to feel very comfortable, after she does her presentation, asking her questions. That's what she's here for. She wants to ensure that she is providing you with the information that you need, to be, like I said, to be able to make informed health decisions. So, Riverside County, there's approximately 150,000 of us that, if you live in Riverside County or reside in Riverside County, and there's still 70,000 that are unvaccinated. Yeah, as of September 26th, yesterday, still 70,000, right, I know. And I'm gonna tell you a story in a minute, a quick story. So let's go to the next slide. San Bernardino, there's approximately 174,000 individuals that identify as Black, and still 91,656 are unvaccinated. So I live in San Bernardino County. I work in Riverside County. So say I got COVID. I'm like, hey, this is my dad, I'm gonna run over here. You got COVID now. I'm gonna go over here, talk to the pastors. They got COVID, right? Because I'm going back and forth every single day between counties. So I could just be a happy little spreader. So that's why it's so important that we get vaccinated, that we protect ourselves. And I know it's tired. You're tired of talking about COVID. You're tired of, when is this gonna go away? Well, it's not gonna go away. And the important thing that I really wanted to hit home, I had an opportunity to hear from one of the Tuskegee descendants. And she was saying that, I'm really, really tired of people associating, Tuskegee with COVID. She was like, how dare they? My grandfather was injected with syphilis and was denied treatment. She said, the difference is we are not being denied treatment. We are just deciding we don't want the treatment for whatever reason. So we're doing this to ourselves. So she's like, don't make that connection, because it's not the same thing. And that really, really resonated with me. And I was like, okay, I'm gonna go and I'm gonna share that, because you're absolutely right. We have treatment, we have resources, we have things available to us. So we need to start accessing them and making our health a priority. So on that note, I'm going to invite Brittany up.
Yes, my name is Brittany Whitmore. Thank you for allowing us the space to talk and have this conversation tonight. I feel it's really important for all members of the community, Black and Brown, of Riverside County. And I would like to also thank the pastors of this church. When I reached out to Pastor Karen Sykes, she answered the call, allowed us to come to Crossword to vaccinate. We vaccinated over 10,000 people from your church. So thank you so much. We appreciate the commitment that you guys have for Riverside County and the residents. So, yikes, I saw my picture up there. I'm like, oh my God, my hair done. I'm so tired. You're tired. I am tired. So, but every time I speak, I feel like I re-energize myself and re-energize people just to kind of just say, hey, COVID is still here. Yes, the masks are off. Yes, their signs are down. Yes, our children are back to school, but COVID is still here. A couple of weeks ago, we did our first town hall meeting. I got a text afterwards. Your son was exposed to COVID-19. I said, no, not Aaron. He can't be exposed. So I know I did everything I could. Aaron's vaccinated. He was one of a couple of the first children in Riverside County to get vaccinated. I definitely made sure I vaccinated my son, but he ended up getting COVID a couple weeks ago. I didn't get COVID. He had it. He had to quarantine in his room by himself. He had a little Dieter and our Alexa. So, Mommy, I need this. So sometimes as parents, we do everything we can, but when we send them to school, we don't have control over what goes on. So continue to advocate for your children to wear their mask and wash their hands. So next slide. I'm moving this slide like it's my slide. So next slide. So I'll go over the spread of COVID-19, symptoms, prevention, vaccination, and resources. Ms. Michelle, you bring up a very great point about the Tuskegee situation. When we have reliable information from trusted resources, and when we don't correlate two separate events, our outcomes are a little bit better because we have a better understanding of what's going on. Next slide. So how does it spread? Through talking. Sneeze, cough, wheezing. I'm touching the surface. I'm touching my nose, touching my surface. Michelle comes up, touch my surface. Now she has COVID. It spreads very easily. We continue to educate and advocate for individuals to wipe down those surfaces. Wipe down your car steering wheel. When you go to the grocery store, wipe down that basket because the virus can definitely live. And when a person is contaminated with COVID-19, they might not show those symptoms that day. Could take up to a couple of days. Anybody in here experienced COVID-19? The majority of us in the room. How many of us are vaccinated and boosted? Oh, jeez. My job is done. You guys are good. But we want you guys to be champions and advocate for your family and friends. So go ahead and go to the next slide. So like I said, symptoms can come up 2 to 14 days after. And everybody deals with it a little bit different. You might have coughing, the chills, sneezing, shortness of breath, fatigue, even brain fog. I won't go into any of the long haul COVID. I'll leave that to the lovely doctor in the back, but loss of taste of smell and hair loss. Any of us experienced COVID? Oh, and just went away. Yes, that happens. Your hair does fall out, so I will dive into that later. Wear a mask and wear a good mask. How many of us wear the mask the whole day? The same mask. You gotta change it. Do you wear a cloth mask? No? Yes? Do you wash it daily? Or you put it on your rearview mirror and let it hang for a couple of days? Get back in the car. Ooh, I have a mask. You have to wash it. You have to sanitize it. Each time you wear a mask, take it off. I had a mask in my bag. It was dirty, but I was like, oh, I have a mask. But I remember, you have to continue to wear new mask each time. Yes, it'll break out your face. Put some moisturizer on it. You'll be good to go. So washing your hands consistently. How many of us have a cute little hand sanitizer in their bag right now? And hand wipes. The best way to clean your hands is with soap and water. The sanitizer is there for you as a convenience, but you want to continue to wash with soap and water. If you don't remember your ABCs, start saying your ABCs. ABC all the way to Z. Wash your hands, dry it. I teach my child that all the time to make sure he is consistently washing your hands. 6 feet apart. Do we still say 6 feet apart? No, we don't. I'm at the grocery store and the lady's right behind me and I'm kind of scooting over and she's scooting closer. I was like, we don't practice 6 feet? No, because we got comfortable. When we get comfortable, that's when we get a little bit laxed. And then the next morning we wake up, our throats are a little bit sore, like, oh, I did everything I did. Still get COVID. It happens to the best of us, but we can prevent it in so many ways by continuing to keep your distance and get tested. How many of us know where to get tested? You do? Okay, good. Is this still a testing location? Would you like to make it a testing location again? Okay. Well, we'll get that done for you. We do have plenty of testing locations throughout Riverside County. And you can still get the free COVID-19 testing kits. Not to put building resilient community out there, but do you guys still provide free testing kits? Yes, we have CBOs that provide free testing kits. I'll have my information at the end. If you guys need those, let me know. If you guys need new masks, let me know as well. Not only do I work in the COVID arena, I'm also a program coordinator for a new health equity program. We'll provide some masks for you if you need it, some extra hand sanitizer. Always feel free to call me and let me know if you need it. All right, next slide. Vaccination series. Everyone ages 6 months and 6 months. Don't y'all feel that's young? I felt it was young. But it needs to be done. Our children need to get vaccinated. As a parent, I was frightened. Like, oh, I don't want to get my child vaccinated. It's so new. I don't want to do that. But the benefits outweigh the risk of getting our children vaccinated. 6 months and older, COVID-19 boosters for everyone eligible 5 years and up. Getting vaccinated after you recover from COVID is also needed. Some might have the mindset as, I've already got COVID, why do I need to get vaccinated? Have you guys heard that before? Yes, you can still get COVID after you've got COVID. And now we're going to talk about the long haul issues of COVID. So please make sure you still get vaccinated. People with moderate to severe immunocompromised health conditions have way different effects, and the CDC also recommends different vaccine series. I'm not for sure if you can scan that QR code, but it'll take you to the CDC website, and you can go step by step. When should I get boosted? Is it time for me to get another vaccine? So since we're all here, go ahead, next slide. We all got vaccinated. Our job is to be champions for our church communities, our home, our children, and our grandchildren, because our children are the future, and our grandchildren are too. If someone in your home is not vaccinated, or I guess I'll give a scenario. Family dinner. Everyone came over. Had that one cousin that wasn't vaccinated. I don't want to make her feel bad. I just provided her a little bit of education, politely handed her a mask, and she can sit right on the side where the kids used to sit, at the kids' table. She's like, Brittany, are you really going to do that? I said, yes. We have older grandparents. I don't know the life that you're currently living, but we have to protect our grandparents. And they're the ones who are the pillars of our community. So I rather say, hey, cousin, go ahead and sit aside. If you don't want to wear a mask, you're free to go outside in a nice, polite way, because we don't want to hurt our family members' feelings. But she had to go outside to protect my grandparents. So talk to your friends and families about getting vaccinated and address the misinformation. There's a lot of misinformation. If I get vaccinated, I won't be able to have children. Or on the male side, if I don't get vaccinated, I won't be able to, I'm not going to say it because we're in a church, fill in the blanks. Right. But those things do happen, and a lot of individuals are scared, will it stop my child's growth? Will I have any other issues? And those are valid concerns, and I always have my patients and clients advocate for themselves. Talk to your doctor. That your doctor has a window time with you. If you have a 30-minute visit with your doctor, and your doctor only sees you for 10 minutes, stay in that room. Ask 3 to 4 questions. I challenge everybody. Every time you go to a doctor, ask questions. They have that time with you. You don't want somebody to push you out the door. Oh no, just take this, you're fine. Why am I experiencing this? What's going on? Why am I still tired? Advocate for yourself. Because if you don't advocate for yourself, you will be another statistic, and no one will advocate for you. Especially our children, they need us to advocate for them. And celebrate your decision. Be confident that you are vaccinated because you're doing your part. We talked about flatten the curve so much. We still have work to do. You saw the statistics that were up there. I feel like as a public health worker, I have more work to do. Seeing that large number of over 70,000 African Americans in Riverside County that need to get vaccinated. So I gotta go do some more work. I gotta go out there and educate individuals in my new role, still continue to educate and do these town hall meetings. Go ahead and go to the next slide. So like I said, protect yourself and your family from COVID-19. Wash your hands. If you're sick, stay at home. Your work is still going to be there. The dishes will still be there. Don't wash them. Just go ahead and get some rest. I have a bad habit. I was raised to, you go to work sick or not. Take yourself to work. But now I can't. If I have any kind of symptoms, hey, I can't come in today. Even though it's mild, I test every week because my son's grandpa goes to dialysis 3 days a week. So I have to protect my family. So any sneeze, just stay home. And seek treatment if you have COVID-19. Are you guys aware that we have treatment options out there? Okay, good. Go ahead and go to the next slide. We'll talk about a couple of treatments. All right, so we have Paxlovid. This word I can all never pronounce. I say just mono. And Bethlomelad. There's a new booster out there. Did you guys hear about that? Kind of scary, like, oh, there's another booster. I have to get another shot. So this new booster will cover Omicron, the strain that everybody's mostly getting right now. So yes, it's another booster. People are afraid to take it. Like, I've already done my series. Why do I need to get another one? It's just to continue to protect your body. Go ahead, go to the next slide. So I did a couple of, sorry, let's stand out the way. I know I'm not that tall, but we have testing resources for Riverside County, myturn.ca.gov. If you don't know where to get vaccinated or tested, you can go ahead and take one of these, take a screenshot of the QR codes. We have treatment centers. There is a form that you will have to go through to see if you're eligible for those treatments. If you have any trouble, my number is up there. I'm going to leave my email. If you want me to advocate for you, I definitely will. That is my job, and I will definitely advocate for our community. My name is Brittany Whitmore, bwhitmore@rithco.org. Oh, that's the wrong one. bwhitmore@ruhelp.org. And that's my telephone number up there. If you need hand sanitizers, masks, know where to get tested, need to get boosted, or just any information that you need, please feel free to reach out to me. Thank you.
Mental health compass for the Black community during COVID and beyond. So thank you.
Thank you. Good evening, everyone. I'll be giving us like a few tips that we can use to, deal with this stress. She already told you I'm a psychiatrist, so my focus will be on the mental health aspect of things. So some of these tips would help us now, but these are also tips that we'll use beyond. So that's why I have it as right now and beyond. Okay, next. So I have no conflicts of interest. And then I just want to say that, this is not a psychiatric evaluation. This is just giving you some tips. And then, like I said, is a guide to help for now and beyond. Okay. So I'm hoping that at the end of this talk, we'll be able to list some of the reasons, because somebody said, I don't know why it's affecting us more, but I hope we'll be able to find out why it's affecting us more than other people, and then list some of the long COVID symptoms, and then list healthy ways to cope with stress. So I always do this. I'm going to ask you guys questions, see what you know. So does anyone want to take this one? Question?
Vaccinated individuals are more likely to get infected with COVID.
Oh, okay. So the question is, vaccinated individuals are more likely to get infected with COVID-19 virus when compared to non-vaccinated individuals.
That's not true. That's false. Not true.
Okay. Does anyone think it's true? Okay. We have a good group. Next. Thank you. So at the beginning of the vaccine rollout, whites were hesitant about getting the vaccination. True or false? They were, it's true. Right? So everyone was hesitant, right? Because it was a short period of time from lockdown, remember? But I think I had my first vaccine by December. So people were hesitant. So everyone was hesitant at the beginning. So that's, and then the third, long COVID has been shown to be more prevalent in the Black community. True or false? What do you say?
I wouldn't know because I'm not in the white community, so I don't know whether, they're showing more prevalent to it, than the Black community. I don't know. I just know what the Black people are saying,
Okay, so what do you think is the answer to this question?
No.
It's false or true?
False.
False. Why?
Look, I really don't know, I'm being honest with you. I really don't know how prevalent it is in the white community than it is in the Black community.
Okay.
I really don't know. I just do know that whites were more adamant about taking the vaccination than and African American as well, but I think whites were more, especially in the white area. My daughter lived in the white area, so I listened to her. So yeah.
So you mean getting the vaccines?
Getting the vaccination, yes.
Oh.
I feel African American was adamant about getting the vaccination as well, but not as much as the Caucasian people.
You mean hesitant?
Hesitant, yes.
Okay. Okay. The statistics shows that everybody was hesitant at the beginning, right? But we'll see more. So how about this question? You said false. Why false?
From what I've seen.
Okay.
We haven't heard as much statistics from the other side, but it has affected everyone regardless of race. I mean, it affects us greatly also,
Okay.
but we don't really hear, but I can't imagine that it's been more prevalent among us than others.
Okay.
I guess, I don't know.
Okay, no, thank you. That's a good one. What'd you say?
I'm going to say true based off of the patterns from regular COVID, but I know we don't have as much information on COVID-19 that's still happening.
That's what it is. So we don't know. So it's false. Well, it's because we don't know. We don't have enough statistics yet to say who is more affected by long COVID. So this is long COVID specifically. Okay, thank you. Next. Okay, so we all know this, right? WHO declared COVID March 11, 2020. The orders to stay home, all that craziness. Then everybody was glued to the TV. And then I like to think that the position of the toilet paper became the greatest predictor of disaster preparedness. Next. So, throughout the ages, human beings have always dealt with periods of uncertainties, right? We think about that saying about survival of the fittest, right? And even though that was originally proposed to define how human beings procreate and replace themselves, as a psychiatrist, when I think about survival of the fittest, I'm thinking, how can we adapt, right? We can't run away from stress, but how do we adapt to stress so that we can survive and then thrive? Next. So one thing that we know, right, through the pandemic and now, and some people say it's coming to an end. Our president says, I think it's over, however you want to define it. What we know is that things are very unpredictable, right? We cannot predict what's coming, right? So we have to kind of hold on to that. And then we've gone from having that infection that was like, oh my gosh, what happened? Who brought it? Who caused it? All of that drama to, oh my gosh, how come we got a vaccine so quickly, right? Like, can we trust it? Can we do it? Can we take it? To now people are dealing with long COVID issues, right? But this is all so many things going on so quickly. So we have to groom ourselves for survival, right? So that's really what this talk is about. How do we make ourselves? So the three big tips that I have will be, we build up the self, right? So we do self-care, we do healthy lifestyle choices, we create meaning. Why am I here now? Why am I part of 2021, 2020, 2022, all of that, right? Why am I here? The meaning. And then what story are you telling yourself about right now? And then you have to educate yourself, right? Because right now, remember the last question, long COVID, is it more prevalent in Black community? We don't know. We don't know. Some of these things you just have to find out. So you don't get your information from CNN or social media. You go to the CDC website. You go to trustworthy and reliable websites, and you keep yourself learning. We're still learning. We don't know everything. So we have to educate ourselves about discoveries. And if we need help, we get help. We don't just, show up at work like Brittany was saying, show up at work even if you're sick. No, if you need help, you get help. Next. So what is healthy coping? So healthy habits like adequate sleep. How many hours of sleep? What's adequate? 8 hours. We say average of 8 hours. Some people say, well, optimal sleep. Everybody's optimal sleep is different, but at least about 8 hours. Adequate fluids, avoiding harmful habits, right? All the addictions, drugs, sex, food, all of that, things like that, harmful habits. How do we stay connected, right? How do we stay connected to our families? When we couldn't meet, right? Most people don't even have their masks on, but when we couldn't meet, we had social media, but now at least we can meet, right? But we still want to do it in safe ways. Faith. I can tell you guys that, that. So research has supported that people that have faith tend to do better, with all kinds of issues. Staying active. I think on my last slide with the references, there's I forget what website that was, but it shows you the guidelines for who should do what, right? So I don't get to tell you how many minutes of exercise you should do in a day, right? It depends on your health condition and all that. So, but we should all stay active, eat right, and then do your general health maintenance, right? So annual PCP, all that at a minimum. Then if you have medical or mental health diagnosis, you go see your doctor like more often. Next. So what is a stressor? So stressor could be anything that threatens your well-being is a stressor, right? Some of them are collective, like all of us sheltering in place during COVID, being Black in America. These are all collective, right? And then individual, like, oh, my husband is cheating on me, or my boss is so, demanding, right? So things like that. So it could be individual, it could be collective. And then when we have stress, some of us fight, some of us freeze, some of us take off, right? So people deal with stress in different ways, right? And we know that things like what happened when mom was pregnant, what your childhood was like, things you're dealing with, your support system, having access to those healthy coping skills, all of those things will affect how we eventually deal with stress, right? Like how we show up. And some of those things are genetically driven as well. Next. So this is what happens, right? We get the alarm. The alarm goes to our brain. It sends messages to the top of your kidneys, and then you get chemicals that get released that affect your whole body. So let's say you're taking a hike, you run, you see mountain lion, a little snake, whatever. You take, this response happens, but it's appropriate, right? It's acute stress. All that happens. Your adrenaline, cortisol, all of that goes up. You take off. You run. You run to safety. But if you have March 2020, you had lockdown, it's COVID, and it's all the stress on and on and on and on. Now it's chronic stress. So if you don't take good care of yourself, you have all these hormones that are running through your body that you were supposed to just use for 5, 10, 15 minutes, get away from the stress. Now it's running through your body all the time. Now we start dealing with hypertension, diabetes, high cholesterol, weight gain, insulin resistance, metabolic syndrome. So we have to learn how to cope. And we don't want to cope with unhealthy coping mechanisms, because people cope, but they cope with unhealthy mechanisms, right? People are gossiping, people are getting into addictions. They're all coping, but it's just unhealthy coping because you're giving yourself more stress. So you have to do healthy coping so that you can deal with stress. Next. So I wanted to run through some of the trends. I know we've mentioned some of them, but I wanted to do this. So Ellie also has been through the course of this. So test positivity, hospitalizations, and deaths among Black and Hispanic Americans and American Indians and Alaskan natives compared to whites, high, right? Next. So some of the theories for negative impact of COVID on Blacks is our dense population density, right? So more likely that we're living in overcrowded areas. We have more underlying medical conditions, as marginalized populations, the social determinants of health. We know all that. And then higher proportion of racialized minorities engaged in the lower paying jobs, right? Who had to go to work? People working in groceries, people driving the trucks, and who makes up that community? Black people and brown people. So that's part of why our numbers are high, right? Essential duties, those essential duties then. And then all the cumulative stress. So remember what I said, being Black in America is a collective stress, right? So if you haven't learned to cope with it right, it stays with you. That means if somebody were to check your cortisol or your adrenaline just randomly, it'll be higher. There's a portion that makes it high because you're Black. If you haven't learned to cope with it, that's the point. So when you're already stressed because you deal with a certain type of stress, so your immunity is lower, you're more likely to get it. So it's just this cycle, right? So, and then access to care. So that's another point. Next. So this is the one letting us know that white people, everybody was concerned about getting the vaccine at the beginning. Everybody was concerned. But as time went on, we lagged. Like you said, that person said, what, that's a whole different ball game. Why are you bringing that up, right? About the Tuskegee descendant, right? So at the beginning, everybody was concerned, but as time went on, other people said, oh, we're going to do this, and they did it. Next. So there have been also some concerns about access to vaccines, right? So there was this was really interesting. So if you look at my last comment, in Washington, D.C. showed that wealthier white people reserved virtual appointments in neighborhoods not their own, which limited their appointments available to Black residents, right? So people who already don't have access, can't get to other places, so little things like that. And then online registration systems, people don't have internet, so then how do so there's all these little things that have made things worse. So this is University of Pittsburgh School of Pharmacy, looking at 94 counties where Black residents had a significantly higher risk than white residents of having a driving distance greater than 10 miles to the closest facility, and another 69 of greater than 1 mile, right? So all these little things add up, right? And you're already stressed out, you're already dealing with other issues, now you have to worry about where to get your vaccine. So all these things add up. That's why it's been hard on the Black community and brown community. Next. But this is something I want everybody to take to the bank. Vaccination prevents development of serious COVID and its consequences. So long COVID, hospitalizations, death. So vaccination is why we can sit in this room right now, not on lockdown, not wearing our mask, because we got vaccinated. It's nothing else. It's not because COVID decided I need to go. No, it's because we got vaccinated and we broke that cycle, right? But COVID is still there. But that's why the rates have come down significantly. So long COVID CDC definitions. Again, you hear me talk about CDC all the time. Britannia also did the same. So if you want information, go to CDC, right? Not CNN. So some people have been infected with the virus that cause COVID, right? Sometimes it's symptomatic, sometimes it's asymptomatic, but then they develop other symptoms beyond the usual COVID infection that they had. So there are all these names that they are called, but one thing I want us to notice is as of July of last year, long COVID is now part of what you can get disability for. So if somebody has had COVID, symptomatic or asymptomatic, and then they develop long COVID, they can actually get disability for it, like you get with everything else. Okay, so to disseminate that information to people that you know. So it's a whole lot of things that could happen. It could happen to people who are vaccinated, it could happen to people who are non-vaccinated, but there's definitely higher numbers among those who have not been vaccinated, right? So almost anyone can get it. So the last point, CDC and partners are working to understand more about who experiences it and why, and wanting to know if there are groups that are disproportionately impacted. So we still don't know, right? We're still learning. So again, keep your ears open, check this website often. Next. Okay, so some of the symptoms. So general symptoms, we have fatigue, tiredness, fever, respiratory symptoms like shortness of breath, chest pain, neurological or psychiatric symptoms, we have like brain fog. That's what I've heard a lot. People have talked a lot about that, where they feel like they can't handle things they used to be able to handle. They're no longer processing as fast. They feel a little slow, can't do things they used to be able to do. So there's that, dizziness, there's sleep issues, anxiety, depression, diarrhea, stomach pain, joint pain. So if you notice, these are all like non-specific things. Like these are things that happen with just about, a lot of things. So if you've had COVID it's tricky when you don't know that you had COVID and you weren't testing. But if you've had it or you've been around someone who had it and then later on you kind of start having some of these weird symptoms that are not going away, then it's important to make sure that you bring it up with your doctor. And even if you bring it up with them and they, unfortunately someone dismisses it, don't let them dismiss what you're feeling, just like keep talking about it. People always say, like, write down the things that you're feeling. Like, you make a strong case when you say, hey, I had COVID on this day, 3 weeks later or 4 weeks later, this is what I had, and now it just won't go away. That's not me, that's not, just you have to advocate for yourself, right? Yes, somebody could argue that these symptoms are not likely, like they're not usually due to this long COVID, right? Like long COVID is still like rare compared to other things, but you. And if you feel strongly that that's what you're having, just keep pushing, keep pressing it on, okay? So what is health? So a state of complete physical, mental, and social well-being, and not just the absence of disease, right? So health is all of that. So this definition was proposed in 1948, and no one's amended it since then, right? So maybe they think it's perfect, but health is that state of complete physical, mental, and social well-being. So it has to be all of that. So all the cylinders running right. That's what health is. Next. So what is mental health? What is mental illness? Mental illness, we have like axis 1 issues, depression, anxiety, bipolar, schizophrenia, PTSD, ADHD, those types of diagnoses. Or axis 2 would be things like personality issues, personality disorders, right? They're all part of mental illness. So before we can say that someone has mental illness, we have to think about how much is that affecting them socially, like relationships, how is it affecting their work, how is it affecting their productivity, right? Things like that. Like we know, like depression is one of the, depression is probably the number 1 or number 2, I forget now, world over, as far as productivity, like what makes you lose all these years that you could have been working. Depression does that. So then you want to also make sure you rule out other possible causes. So somebody has low energy, feeling tired all the time. Is it long COVID? Is it hypothyroid? Or are they depressed, right? So you have to always kind of think about other things. And then what is the level of severity? Like how bad is it? Like how much is it affecting them? And then what are the modalities of treatment? Next. Okay. So lifestyle. So sometimes if someone have like mild depression, maybe they don't need to they don't have to be on medication. They don't have to even do therapy, maybe just doing like lifestyle, getting enough sleep, do the exercise, connect with the people they love and things like that. And then we move on to like psychotherapy. There are all types of modalities of psychotherapy, and a lot of them are evidence-based. And then we have psychotropic medication management, right? So then the medications, we bring those on. We want to use medications when we have at least like really moderate to severe, right? So not like mild instances, right? Because all our medications have side effects. And so you always want to make sure the benefits outweigh the risks, right? Because before you put someone on medication. And then most times we do combination. And then there are other types of treatment like ECT, TMS, ketamine, and light therapy. Next. So again, just to summarize, we need to build up the self. So self-care tips, create meaning, healthy lifestyle, self-compassion, take care of yourself. And then the second one is educate yourself. There's so much we don't know. There's so much we still have to learn about COVID. So keep yourself educated, not through CNN or other social media outlets, through CDC. That's the website you want to be. And then if you need help, get help. That's it. These are my references.